Hello there, my name is Dr. Linus. I am a pharmacist. I live in Uganda. If you're visiting this channel for your very first time, do not forget to subscribe because on this channel I actually educate and inspire. And we always upload videos on this channel at least 3 times a week. So you are assured of as many videos as possible. And that's the reason why you should not hesitate to subscribe on this channel. Today I want to talk about pregnant women and why pregnant women should avoid liver. I believe you are surprised. Liver tastes really nice, and I want to believe when pregnancy comes, you always tend to maintain the appetite for liver, possibly. But why should you avoid eating liver? The reason is very simple. This liver that we are talking about is a big store. For one of those vitamins, mainly vitamin A. And vitamin A is the real issue why in pregnancy we have to be careful not to eat liver if you are a woman and you are pregnant. Talking about vitamin A, there are 2 forms of vitamin A. There is the vitamin A that we call retinol, and retinol is available in very high levels in liver and some fish products like fish liver oil. Okay? And this retinol is available in safe levels in dairy products and eggs. Okay? Safe levels in dairy products and eggs. The other type of vitamin A is what we call beta-carotene. And this beta-carotene is the ingredient or is the substance responsible for the yellow color that we see, for the yellow, the orange, and sometimes the red color we see in some fruits and in some vegetables. Okay, so when you look at things like oranges, carrots, okay, the main ingredient there that is giving them that color is what we call beta-carotene. And beta-carotene in those fruits and vegetables is in safe levels. The body is capable of converting the beta-carotene in those fruits to vitamin A, which is in the safe levels that are not harmful. Okay? What is the danger of vitamin A being in high levels? First of all, you need to remember that vitamin A is a fat-soluble vitamin. We generally categorize vitamins into 2. One category being the fat-soluble vitamins, that is vitamin A, D, E, K, okay? And then there's the other category of vitamins that we call the water-soluble vitamins. And these are usually the vitamins that fall in the range of Bs, vitamin B1, B2, B3, B5, B6, B9, B12, all those are water-soluble vitamins. The other water-soluble vitamin is vitamin C, ascorbic acid. Okay? So when it comes to the fat-soluble vitamins, them being in high levels in the body can actually cause some problems. And vitamin A being a fat-soluble vitamin can actually cause problems when found in high levels. What is the danger of having vitamin A in high levels in the body? 1, high levels of vitamin A in the body have been associated with breaking of the hair. This hair starts to break. Okay? It has been associated with rash on the skin when the levels are really high. When it comes to the bones begin to weaken. Headache has also been associated with high levels of vitamin A. So if these symptoms are seen in an adult human being, how much would then the unborn baby be affected? Okay? Now, the reason you're being discouraged from eating liver is because the liver is the biggest store of vitamin A. And so when you eat this liver, you're giving yourself a high level of vitamin A that can actually cause problems to this unborn baby. You'll find that vitamin A has been used in some medications basically for treatment of skin issues like acne. Isotretinoin has been used to treat acne. But because it is a form of vitamin A, these pregnant women cannot take isotretinoin simply because it can actually cause danger to the unborn baby. And this child will actually be born with some birth defects. You get a point? So, what is the relevance of vitamin A in our bodies? Vitamin A is quite very, very important when it comes to the sight, our eyesight or our sight. Vitamin A has been found to be very, very important with the vision, especially because it improves the activity of the photoreceptors in the eyes, and so therefore your night vision becomes good. People who have been found to be deficient in vitamin A are the people that have a problem of night blindness. You get the point? The other role of vitamin A has been found in immunity. When it comes to the third trimester, the last 3 months of pregnancy, that is the level where now the demand for vitamin A in pregnancy becomes high because of this child who is now maturing very fast. This child needs to store enough, this unborn baby needs to store enough vitamin A that will prepare them for the first few months of their life. Because their immunity has to be also at a level dependent on how much vitamin A they were able to store during the time they were in the womb. So you'll notice that in the third trimester, in the last 3 months of pregnancy, that's the time when the demand for vitamin A by this unborn baby begins to shoot high. And so that's the time when the pregnant woman has to be taking a lot of these foods that provide a good source of vitamin A that is not toxic. So things like dairy products become very important because they provide a good level of vitamin A. Okay, fruits and vegetables, they provide a good source of vitamin A that is safe and tolerable to the body. But things like the liver that store, fish liver oil that store a high level of vitamin A must strongly be discouraged, be avoided by a pregnant woman because they otherwise put this mother and the unborn child at risk. So then, to maintain a healthy intake of vitamin a pregnant woman should do the following. 1. Avoid taking supplements that contain vitamin A. The vitamin A obtainable from the dairy products, from eggs, from vegetables and fruits is just sufficient. It's just in safe levels that should not actually cause any worry. Okay? The pregnant woman should avoid eating liver because, as we've seen, the liver is a huge store of vitamin A, which can actually cause problems as this woman continues to consume the liver. Okay? If you've been watching this video from where we started, do not forget to subscribe to this channel where we inspire and educate. Okay? Also remember that COVID-19 has affected every country, world all over. Okay? Let us keep safe. Let us maintain good social distancing. Okay? Wash hands as much as possible to make sure that all the time our hands are clean. Avoid touching the mouth, the nose, and the eyes. So if there is no reason why you should leave home, I want to encourage you to stay at home. I personally use a hand sanitizer called InstaClean. It does very well for me. And every time I want to be sure that my hands are clean, I use InstaClean, and it's always available on my table. So don't forget to subscribe to this channel because I'll keep bringing you inspiration and education in aspects of health. Thank you very much. Bye.